Hey everybody, we're going to continue our deep dive, take a breath, into the female anatomy. And today we're going to focus on the labia, because this is probably the number one part of the anatomy that I have patients come in concerned about, or messages and comments that I get on here because they say, does theirs look right? Or this sticks out further than this side, or this is uneven, or why is this a different color than that? All types of different things, because this is the area that women have been made so self-conscious about because of Hollywood and the adult industry and really good editing and lighting that leads women to be self-conscious and uncomfortable about their own anatomy. So we're going to talk about the labia, and we're going to make sure that everyone understands what it is, what it's made of, and what its purpose is, because there's nothing wrong with you, I promise. Now, first of all, this is the labia majora, or the outer lips, as it's called. This is basically skin and fat tissue with hair follicles. So it is absolutely normal to have pubic hair here as well as up on the pubic mound. Totally normal. And as we talk about all the time, pubic hair is normal and natural and protective. So you don't have to worry about it. You certainly don't need to worry about it because you're coming in for an exam. We see it all. Next, you have the labia minora. Now, this is a much thinner and much more delicate type tissue, and it is filled with nerve endings. And actually, the clitoris, which we'll focus on in another video, actually has kind of limbs that come down all the way along the labia minora. Now, the labia minora is actually made up of erectile tissue. So during intimacy and arousal, it can actually become engorged and even more sensitive. So during those types of activities, it's important to pay attention to these structures. They matter, okay? Now, it's also important to note that of everyone who gets upset about the way the vulva looks or has an opinion about it, the labia majora is the exact same tissue that ends up making up the male scrotum. So if you think that something about this doesn't look right, think of the alternative, and I say that as a man. So it's important to understand the purpose. The labia majora is like I said, it's a skin. It is much tougher, and its main job is to protect the more delicate inner tissues. The labia minora, while sensitive, more filled with nerves, and erectile tissue, it still has a protective function, which is to protect the urethra and the vaginal opening. Remember that everything serves a purpose here, and it's fine. Do not get hung up in what society, and damn sure don't give a fuck what some man thinks about the way things look. If I've said it once, I've said it 1,000 times. If they don't like the venue, don't invite them to the party. Now, the next thing here is to remember that while everything serves a protective feature, right, we do need to make sure that we are keeping things clean and safe. Never wash with soaps or douches or anything like that internally. Externally, a pH balance or gentle cleanser is probably fine, but never use anything internally. Now, as we continue, right, another important thing that I want you to keep in mind is that as you age, things are going to change. So as you can see here, the labia minora on this model actually sticks out past the labia majora, and this can be a point of major anxiety and shame for a lot of women. But there have actually been studies that show that this is more common than not. So don't worry about it. And no, they're not going to be perfectly symmetrical and even. They're not meant to be. It's fine. But as you age, and especially as you enter perimenopause and menopause, you can actually experience a condition called genitourinary syndrome of menopause, or it used to be called vulvovaginal atrophy, which essentially is as estrogen decreases and we lose collagen, or rather, you, women, lose collagen, this tissue will actually lose some plumpness, or if you don't like that word, it'll lose some thickness. This is a normal part of aging as you enter this stage of life, but there are options that can help. intravaginal estrogen is a great option and has very few contraindications because it stays local and is generally not absorbed systemically in the same rates as like oral estrogen, for example. Now, as long as you don't have any significant contraindications, and I do want to point out that a lot of people think that they have a reason that they cannot be on hormone replacement therapy, that they don't. That's outdated science for a lot of people. So it's important to talk to a women's health provider who specializes in this and is up to date on the most current recommendations regarding women's health. Are they up to date on the current Women's Health Initiative, for example? Because this matters. Hormone replacement therapy can make a massive difference on genitourinary syndrome of menopause, because another thing that we find is as this tissue does begin to shrink, you can actually end up experiencing additional urinary tract infections, yeast infections, and things like that. So protecting your overall vulval health is incredibly important, not to mention just your overall mental health and satisfaction with your body. But if I can stress anything in this video, please let it be this: that I don't care if one lip sticks out 6 inches further than the other. I don't care if they are slightly discolored. I don't care if it is the Amazon fucking rainforest covered in hair. If you are healthy, if you are clean, and if you are confident in your own body like you should be, then it doesn't matter. Don't let anyone else's opinions or thoughts on your body impact the way that you feel about yourself as a human, as a woman, as a vulva owner, because you are perfect just the way that you are. Let me know what you want to talk about next and what other parts about the human anatomy we should cover, because we're not going to stop talking about the taboo and educating on the things that people deserve to know.